Hey everyone, Dr. Mike here. Today we're going to talk about something you might have never heard of, but it's incredibly important to understand, especially if you enjoy the outdoors or work in certain environments. We're diving into a condition called histoplasmosis. It might sound like a complicated word from a medical textbook, but my goal today is to break it down so that it's simple and clear for everyone. This is a fungal infection, and while many people who get it won't even know they have it, for others it can become a very serious health problem. Understanding what it is, where it comes from, and how to protect yourself is the first and most important step in staying healthy. Put simply, it's an infection caused by breathing in the microscopic spores of a fungus called Histoplasma capsulatum. Think of these spores like tiny seeds that can travel through the air. If you've ever explored a cave, cleaned out an old chicken coop, or worked on a construction site that involved digging up old soil, you could have been exposed without realizing it. This fungus is more common than you might think, particularly in certain parts of the world, including major river valleys in the United States like the Ohio and Mississippi river valleys. This isn't a mushroom you'd see growing on a log, it's a dimorphic fungus, which means it can exist in two different forms. In the environment, like in soil or droppings, it exists as a mold with long thread-like structures called hyphae. These structures produce the tiny lightweight spores that can become airborne. It's these spores that are the source of the infection. When you breathe them in, they travel deep into your lungs, where conditions are very different. Once these spores reach the warm, moist environment inside your lungs, something amazing and scary happens. The fungus changes its form. Your body's immune system, specifically cells called macrophages, will try to destroy these yeast cells. In most healthy individuals, the immune system wins this battle, containing the infection and providing immunity against future exposures. Histoplasma is not evenly distributed across the globe. It has a strong preference for specific climates and environments. In the United States, it is most famously found in the central and eastern states, particularly in the Ohio and Mississippi river valleys. States like Indiana, Kentucky, Missouri, Ohio, and Tennessee are often considered the heartland for this fungus. However, it's not limited to just these areas. The fungus thrives in soil that is contaminated with large amounts of bird or bat droppings. This includes old chicken coops, which are a classic source of outbreaks, areas under bridges where pigeons might roost, parks with large populations of starlings, and the entrances of caves where bats live. Imagine a family decides to tear down an old shed in their backyard that has been sitting there for decades. Pigeons have been roosting in the rafters for years, leaving behind a thick layer of droppings. As they start the demolition, dust flies everywhere. The transmission of histoplasmosis is quite straightforward, but it's a process that happens completely out of sight. It all begins with disturbance. The histoplasma spores are dormant and relatively harmless as long as they remain settled in the soil or dust. Once these microscopic spores are floating in the air, they can be breathed in without you even knowing it. They are so small that they bypass the natural defenses in your nose and upper airways, traveling deep into the small air sacs in your lungs called the alveoli. It is absolutely essential to understand that histoplasmosis is not contagious. You cannot catch it from another person or an animal in the way you would catch a cold or the flu. The infection comes exclusively from inhaling the spores from the environment. A group of friends decides to go exploring in a local cave system that is known to house a large bat population. As they walk through the cave, their footsteps and movements stir up the dry dust on the cave floor, which is rich with bat guano. Unknowingly, they breathe in the airborne histoplasma spores. After someone inhales the histoplasma spores, there's actually an incubation period that typically lasts from 3 to 17 days before any symptoms appear. However, the fascinating thing about histoplasmosis is that the vast majority of people who get infected, maybe as many as 90%, will have no symptoms at all. For those who do get sick, the symptoms are often very similar to the flu or pneumonia. The most common symptoms of acute histoplasmosis include fever, chills, headache, muscle aches, a dry cough, and chest pain. Extreme fatigue is also a very prominent feature. While most people recover without issue, certain groups are at a much higher risk of developing a severe, long-term, or widespread form of the disease. The most significant risk factor is a weakened immune system. This includes people with HIV or AIDS, organ transplant recipients who are on immunosuppressive drugs, cancer patients undergoing chemotherapy. In these individuals, the infection is not contained in the lungs and can spread throughout the body. This is called progressive disseminated histoplasmosis, and it can affect almost any organ, including the adrenal glands, liver, spleen, and central nervous system. It is a very serious condition that can be fatal if not treated. Diagnosing histoplasmosis can be, honestly, a real challenge for doctors because its symptoms overlap with so many other common illnesses like community-acquired pneumonia, influenza, or even tuberculosis. The first and most important clue for us is your history. I would ask you questions like, what do you do for work? What are your hobbies? Have you recently traveled, especially to areas where this fungus is common? Have you been involved in any activities like cleaning an old barn, exploring a cave, or working on a demolition project? If we suspect histoplasmosis based on your symptoms and exposure history, we then move on to diagnostic testing to confirm it. One common method is through blood or urine tests that look for antigens, which are small pieces of the fungus that your body might be shedding. In some cases, especially if the infection is severe or the diagnosis is unclear, we may need to get a direct sample from the affected area. This could involve a bronchoscopy, where we use a thin, flexible tube with a camera to look inside your lungs and collect a sample of fluid or tissue. The good news is that for the majority of people who have mild symptoms, no specific treatment is needed. Just like with a mild case of the flu, your own immune system is fully capable of clearing the infection. In these situations, we would recommend supportive care, getting plenty of rest, staying hydrated, and using over-the-counter medications. However, for individuals with more severe, long-lasting, or widespread disease, treatment with antifungal medication is absolutely necessary. The most commonly used antifungal medication for moderate cases is a drug called itraconazole, which is taken as a pill for several months to a year. For the most severe forms of histoplasmosis, such as progressive disseminated disease or severe acute pulmonary disease that requires hospitalization, we start with a more powerful intravenous antifungal medication called amphotericin B. This drug is very effective at quickly getting the fungal infection under control. Recovery from severe histoplasmosis can be a long process. Patients need to be monitored closely by their doctors with regular follow-up appointments and blood tests to make sure the treatment is working and not causing any significant side effects. The prognosis for people who receive appropriate and timely treatment is generally very good. As with so many health conditions, the best strategy for dealing with histoplasmosis is to avoid getting infected in the first place. Prevention is all about awareness and taking simple, practical steps to reduce your exposure to the fungal spores. Before you start any work that will create dust in a potentially contaminated area, you should first spray the area down with water. The single most effective piece of personal protective equipment you can use is a respirator mask. You need to use a properly fitted N95 respirator. For those who are in the high-risk groups, people with weakened immune systems for example, it is even more critical to be vigilant. You should try to avoid activities that put you at risk altogether. So, we've covered a lot of ground today on the topic of histoplasmosis. We've learned that it's an infection caused by a fungus that lives in soil enriched by bird and bat droppings. We've talked about how people get infected by breathing in airborne spores when this soil is disturbed. The main message I want you to take away from this is not to be afraid of the outdoors, but to be smart and informed. By understanding where it lives and how it spreads, you can take simple and effective steps to protect yourself. This knowledge empowers you to continue enjoying your life, your hobbies, and your work safely. If you ever develop unexplained flu-like symptoms, especially a persistent cough and fatigue, and you think you might have been exposed, don't hesitate to talk to your doctor. Stay informed, stay safe, and as always, don't forget to make your health a priority.